Hello everyone. I welcome you all to this faculty development program, and we are doing a pain management in this session. We have our expertise Dr. Uday Kulkarni sir and myself Dr. Jay. We are going to have this interactive section on the topic marking of points, region, lesion and ligand concept.
Thank you, Dr. Jay. As we are moving ahead with pain management through viddhagni, one of the important concepts is marking of the points for viddhagni. Unless we know where the pain is, and if we are able to mark those points and then move ahead, marking of region, lesion, and ligands is very essential step in it. And we have to understand these markings in a proper way. We have a special need of marking these points in this particular way. That is what we are going to discuss today.
So we had some questions there actually. Today, the concept of elaborating on your ligand and how does it go beyond the we have both traditional marma and acupuncture treatments. So would you please explain how did you develop this theory?
As everybody knows, whenever we are working with marking on body with viddhagni, viddhagni is such a treatment which gives instant results, everybody knows. But for that, we have to understand whenever we are going to understand where to puncture, it cannot be complete. So where to puncture comes with identifying the points. So first we have to understand the region has to be marked. Somebody is having pain on his knee. So whether it is on the inside of it, whether it is outside, we have to mark that particular area. That is called as region marking. The region marking is very simple. You know the area where it is paining and mark it out with a marker pen or sketch pen, whatever is available in your clinic. So once you mark the region, it could be inside, it could be outside, it could be in the muscles. The shape of region marking could be round, it could be elongated, just like one particular balloon, or it could be something like an egg. The markings could be anything. But these regions tell us where we are going to do that viddhagni afterwards. This is first step of understanding, and that we have to carry out on the entire body. When somebody is having pain at different regions, we have to mark those regions. It could be neck, it could be anywhere on the chest. So once you know which area is giving patient pain, those much of regions you have to work out, and that gives you idea about how much time it is going to take you to do the treatments. Somebody may say, oh, my entire calf is paining, so you have to mark the entire calf as the region. Region is nothing but the area where there is pain and patient is complaining about it. Once you mark out the region, you can estimate how much time is required. Secondly, region also gives you an idea of which kind of tissues are involved. If somebody is saying I am having pain on the shin bone, that means bone is something which you have to take care of. If he is saying it is in the calf or muscular area, you can decide which kind of needles you can use. So marking of region is going to be primary thing in viddhagni. This marking begins with patient's own perception of pain in whatever part of body. If he says it is generalized pain, we have to understand the what treatments we can offer to him. It could be just the Agni Karma by touch, the touch method which we call. The other thing is if it is muscular area, it could be just Viddha or Vedana Karma. And if it is point specific, if it is located to a particular area, it could be viddhagni in itself. So marking of regions is going to give us idea of the required time to complete the process, what kind of needles you can use, and the outcome of the treatment. So region marking is really first part. Then comes the lesion part. Wherever somebody is having pain, we have to find out the exact point of pain, origin of pain. It could be inside of that particular joint. Sometimes patient says it is inside of my knee, but it is represented on a particular part of the skin. So the pain may be originating from inside of the joint, but it is represented at a particular area. So that area you have to mark as the lesion. Lesion is something where pain is actually represented by the body. It is a signal given from that particular part. So we have to mark that lesion. Once you know the region and the lesion, the next step is always try to get that patient into the position when he is getting maximum pain. So it could be while he is standing, while he is climbing the steps, while he is sleeping, while he is running. So you have to simulate those particular actions or the positions where he is having pain. This is particularly connected with the moving joints. If somebody is having pain in the knee, the joint is moving. So you can understand when it is giving him pain, when he is folding the leg, when he is stretching the leg. So it could be flexion or extension. It could be twisting the leg. It could be bending the leg. So when that patient gets pain, in which position or in which action he is getting pain. He may be getting pain when he is trying to climb the stairs. He may be getting pain while he is climbing down the steps. So those actions may not be possible for you to go and actually ask the patient to run. But while running, if he is getting pain when the patient pain is there and leg is folded and he is getting pain, so you have to simulate that particular action. So if somebody says, "Oh, I am getting pain when I lift 2 kgs of weight," you have to give him 2 kgs of weight and then mark the point as lesion points. So unless we follow this simple rule, you won't be able to alleviate his pain to the perfection. So whenever we are trying to mark the region, the idea is simple, that tells us what kind of needles we have to use, what kind of time it is going to take. Lesion is actually the roadmap to success of viddhagni. If somebody is having that clear idea, okay, this particular point is giving pain in this particular, what we call as the position and this particular angle, then your results are enhanced. So whenever we are trying to work out with the movable joints, these are two important things. Then comes the areas which are not movable. In these areas also, just on the scalp, you may not be able to mark the points in terms of region. So general part of skull, you can mark it out. Then the lesion points, if possible you mark it out. When it is on the skin, you can definitely mark out, but within scalp you cannot be marking. But still you can find out the points where the pain is, just like in migraine. you may be getting pain in the head. It could be trigeminal neuralgia, and then you may be having pain across a particular area. So these lesion points we have to mark out where there is no movement. These are static points. So in static points also you have to mark the lesions. Sometimes somebody is having pain due to cancer or some other major diseases, and then the pain origin is at some other point and a representation is at some other point. Just like in renal colic, pain originates from the kidneys and it is represented on a particular part of your skin. You cannot puncture at the site of the origin, that is kidneys, but wherever it is represented, you can definitely puncture. So that is what happens when we are doing with the visceral organs, where pain is originating from some area, represented it in on the skin in some other area. You have to mark the lesion where it is represented. So these three things we have to understand: moving joints, static parts, and third is the visceral organs. This way we have to connect the region, the lesion, and we have to mark the points. On the skin, marking points is tricky sometimes because somebody has already applied oil. You may not be able to mark it properly. So you have to first wipe off the area, apply some antibiotic or antiseptic solutions. You can apply Trifla Kashaya also. Clean up the area and then you start marking it. Then your markings are clear and you can follow the steps. When we come to the next level, it is ligand. Ligand is nothing but way to mark the lesion in such way that your sequence of the Vedan is determined by it. This Vedana is very essential thing in viddhagni. The name itself suggests that you are doing Vedan and Agni. So when you are going to do Vedan or Agni, you have to understand that there is a particular sequence. The sequence could be marking the lesion points in particular way, and it is basic simple calculation which is based on number of needles and painful points. So if you have 15 painful points and if you have 5 needles, that means each needle has to be used 3 times. So if you have 5 points which are marked circle, that means those points are to be punctured first. When you are having first parts marked, the next comes the triangle, and after that comes the square or rectangle. So ligand is nothing but converting the lesion points into sequence, the sequence which can be taken up as your pain alleviating way to complete your procedure. So always we have to understand how many points we are going to treat. Those points are to be sequentially marked, and that sequential marking is called as ligands marking. And this ligand marking is always connected with the simple mathematics: number of points we have to puncture, number of needles you are going to use. Generally, same needle is used 3 to 4 times in the same patient in the same sitting. So if you have 4 needles and if you are going to puncture 12 points, then it is each needle used 3 times. So you have to make clear to yourself how many needles I will be required to use in a patient. The maximum number should not go more than 6 at a time. It could be 3, it could be 4, it could be 5 or 6. If points are more, you can use up to 6 needles. If points are less, you can use even 3 needles, and each needle should not be used more than 4 times. So this is simple mathematics which we have to understand when we are marking it as ligands. I hope this clears the first step of understanding the ligands. Ligand understanding is very essential when we are taking out Agni or Viddhagni from gray area of medical practice into the simple protocol based treatment. So protocol is nothing but how we understand where we have to go and how we have to go, and something which is reproducible. If I am doing something, you will be doing the same thing in some other patient. It is nothing but having a protocol based practice, which is people demand that it should be protocol based. So something done in my center should also be done in your center in the same way. Then we can say we are from the same school. So in any science, unless this school of thoughts is developed, we cannot say that we have some particular way of doing a treatment, and that is going to be carried over. As we are talking on platform of SAM Global University, we are talking to hundreds of students each batch. So these batches are going to carry it forward as a tradition. They are going to carry it forward as school of thought of Viddhagni. So they will be carrying this particular tradition. So it will be a protocol based treatment. Wherever they go across world, they will be carrying this particular idea that lesion is to be converted into ligands, and then we can convert it into a treatment point, and then they are going to give the same uniform results everywhere and in each patient. That is why we have to understand and master the idea of ligands.
It was a nice explanation, sir. Actually, Sarah told the marking places and about the brief explanation on lesions and everything. But I also need to know the step-by-step palpitations methods on the anatomical landmarks in our body. So, will you please explain the same thing? Because the explanation was very nice. The marking places of lesions. Will you please?
As everybody knows that there is, at some point of time, Ayurveda has also mentioned about marmas, the points which, if touched the wrong way, can lead to death, or it could lead to some weaknesses. And with help of modern anatomy, we can recognize these points and the structures associated with it. So whenever we are trying to understand the marking points for Viddhagni, we also have to understand that there is something which also has to be taken care of, and that is the marma points. The Vishalyakar marma, Pranaghatak marma, all these things are connected. And if we understand while marking itself, okay, here I should not be puncturing, then it becomes very easy for the next generation to follow it. So wherever we are trying to work out with region lesion ligand concept, we also have to keep in mind that the marmas should be avoided for application of heat, because whenever we are talking about marmas, modern medicine has also given similar kind of or parallel kind of things which say that if these points are touched, there could be some weakness, just like on Achilles tendon. If you have an impact, then the leg becomes very weak and there could be limping throughout the life. So we have to understand whenever we are trying to work out with region, lesion, ligand or marmas, these points are anatomically proved, just like in snuff box. We call it uh, a marma on one side, and on the other side modern medicine may be calling it with some other name, but ultimately same points will be there because body has not changed over the period of last 5000 years. Body is same. So wherever there is mention of marma, there will always be some structural weakness within our body which we are addressing. So we should avoid those marmas. Snayu marmas are said to be giving pain, but they are not life threatening. Just like if you are connecting any of the marmas with arteries or nerves, they could lead you to some long term problems. If you know those particular areas, wherever there is superficial nerve, wherever there is superficial artery, which you should not puncture, those particular parts we can avoid, though it may be mentioned as marma or not. We have to avoid those areas where you find nerve at the surface area. So if we avoid those points, and if at all we are unsure about where marma is, because anatomically it may have some anomalies. So in such cases, always do puncturing first, and these needles are so fine that they may not give you that bad effect. Since we have done more than 30-40,000 patients, we have never ever got any of the permanent or long term losses to the patient in terms of when we connect it with marmas or the points which give you pain. Generally, you don't get pain at marma when you are trying to work out with pain management. The pain is always associated with either musculoskeletal internal weaknesses or the osteophytes which give pain, or it could be related to nerve pinching somewhere in the back, just like sciatica and represented on the leg. So it is very imperative to understand that marmas in itself never give you a pain. So what part of science we are learning is related to pain management, and if the marma itself is not giving you any pain, naturally your puncturing is not going to be there where there is a marma. So that way also we haven't actually evidenced or faced problems where you are puncturing into marma, because marma in itself is not giving you pain and you are marking only points which are giving you pain. So we can say it is the nature's direction to puncture and its nature direction to avoid the marmas. So generally we don't face this marma puncturing and getting some kind of problem in the real life.
So it was a nice explanation, sir. So we could like to know the concept of the strategies what you're following in with the karma in various acute and chronic cases. So will you please explain, sir?
Whenever we are trying to treat any patient, always there will be something connected with the patient where he is having right now knee pain, but it may be having history either of a trauma when it is acute pain. It could be fall, it could be sports injury, anything, or it could be an effect of something which has happened some days or months back, and now he is still carrying the pain till now. So there is some what we call a systemic deficit or problem related with that particular area. As the Ayurveda says, it is stan samshay vyakti bhed. So it could be something which is related to vyakti or bhed, which has already happened. So there is structural weakness already there. So in such cases, when you are treating the patient, you have to treat him for the current pain first, and then add something which will be helpful for him to control his chronic problems along with viddhagni. We always have to remember whenever we are treating any patient for pain, it will always be having some or the other history. The history will be either short or long. Any kind of history, you have to go for viddhagni for immediate control of the pain. And then look out for the complaints and history, then treat accordingly. Then you get better results, even in chronic patients also. So, our understanding of this region lesion ligand concept also connects us to this particular aspect, since when the problem is there, any kind of pain, acute or chronic, you have to go for viddhagni based on the complaints what he is eliciting to you. It could be acute, it could be chronic. If it is chronic, you have to add medicines, you have to add panchakarma. If it is acute, you have to add something which is supportive, or it could be just relaxation, rest, and that will take him out of his problem. So you can differentiate your treatments: viddhagni plus treatment for the chronic problem, viddhagni plus immediate action for the acute problem. Then you are more successful.
It was a very good explanation, sir. So I have one personal query that the anatomical conditions of the peoples may vary because some were obese and some were extremely lean. So how will you process the marking processes in the concept of Viddhagni? Will you please explain, sir?
Whenever we are trying to mark out any of the problem, as you rightly said, Dr. Jay, whenever somebody is having pain and the area of origin and your area of puncture, that space is sometimes less or more as per the patient's prakriti on one side, as per his general condition, as per his age, as per his rural or urban status. We have to understand one thing that connects us with the depth of insertion. So, depth of insertion you can determine with your experiences, and generally, if you find that at a particular point he is having pain and there is lot of fat in between, then you have to use the longer needles. So, choice of needles is very well connected with this obese, non-obese conditions, prakriti, his what we call as tolerance power. Then in some patients the skin is very thin, thick. So it is again connected with prakriti. So when we are treating some kind of vikriti, we have to understand prakriti of that particular individual. So though it is generalization of the treatment, still we have to understand that it is also the tailor-made treatment which you have to design for each and every patient. It is very specific for each patient, but there is still a generalization. And that generalization, if we follow, 90% of the patients are going to get good results. And the rest of the 10 may require a little bit of expertise. But most of our faculty members who are going through this particular training will be benefited up to 90% in cases, and rest of the 10% cases we can discuss in the monthly meetings and then work out some strategies for those patients also. So I think all the SAM group Ayurveda doctors who are at present part of this learning program will definitely be able to give results to 90% of them, their patients surely, and 10% maybe we'll have to call them for the special OPDs.
Thank you very much, sir. It was a very good explanation. And I had a last and final question is that Nowadays we are in their lifestyle we are belonging many thing on diagnostic protocols. We are going through the modern diagnostic protocols only. So is there any role for the modern diagnostics, example usg, x-rays, everything, whether you have adopted these things in the field of viddhagni? Will you please explain, sir?
Whenever we are doing any of the treatment, Dr. J, role of investigations we should not ignore at all. The investigations related with the problems which we are dealing with, just like in visceral pain, you may be wanting to know whether there is any renal calculi and where it is. It could be related to X-ray or MRI of the joint which you are treating. It could be back X-ray for patient of sciatica. So role of investigations is very important. But always remember, instant pain management comes before the investigation. So you first do the treatment, control his pain, and then send him for the investigations for rest of the things. So even if you don't have patient's x-rays, patient's sonography or blood investigations, you can always use viddhagni as first line of defense, first line of action to control his pain. And if he needs further treatment, we are always open to going for the modern investigations so that we diagnose it correctly. We start with Ayurvedic treatment, or if required, further panchakarmas. So, role of investigations is always important, but that comes after our first line of mechanism, that is, first protect the patient, first make patient comfortable, and then go for the investigations.
So friends, it was a very nice session with Dr. Kulkarni, and I would know that you have gained a very good knowledge from him, and thank you so much, sir, that we have gained a very good knowledge. Thank you so much.
We'll continue with this lecture series with further topics, and we hope you are enjoying it. Thank you.